Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. We'll be back this week talking about our upcoming Gold Neonatal Online Conference 2024. That's right, you can find all the details at goldneonatal.com. The website's super easy to remember, so you can head over there, check out all the details. When it starts, okay, because that's going to be important. You want to come and join us, of course, for our opening keynote with Niels Bergman, which is going to be fabulous. We've also got such great topics throughout the session. And of course, we have Nadine Griffith, who is here with us today. Nadine, your topic is just fantastic. I have to say, Nadine, of course, you are a pre-recorded session, so that is going to be live at the opening of our conference, linking neurodevelopmental care evidence to bedside clinical practice. And I have to say, anyone that comes and listens to your presentation is going to be absolutely delighted. I'm still so happy with it. It really fills in the gaps. And I think you talk a lot about that in care. So tell me a little bit about yourself and why this is a driver for you, because I know how passionate you are about it.
Thank you so much, Fiona, and thank you to Gold for the opportunity to present as part of the conference. I am a clinical nurse consultant and I'm based in a neonatal intensive care, which is a surgical NICU in Sydney, Australia. And my background is that I was actually a pediatric intensive care nurse and I also worked in kids ED. So when I came into the NICU, I didn't really have an understanding of the brain and how it develops and what the big effect the environment has on it. And things I'd been taught in other clinical settings was sort of counterintuitive with what we were doing in a NICU, which is growing a brain. And so when I started in the neonatal intensive care unit, I actually undertook a lot of training and I became quite passionate about how we can support parents to care for their babies in the NICU whilst supporting that baby's longer term development. And sort of the aha moments for me were when I saw that how you interacted with that baby influenced how they responded physiologically and behaviorally. And so you have this capacity to make such a difference. And we are in this unique privileged position where we can actually support parents to do this and get into that synchrony with their baby, because that serve and return behavior where the baby does something and we respond is linked to their developmental outcomes when they're 18 months old. And more recently, my nephew was born during the pandemic prematurely in another country. And so I feel like it got a bit more personal when I watched my family go through a NICU as well.
I tell you, I know that as part of what you do is that you're also teaching as well. And, you talked a little bit about this off camera and how things have really changed quite
Yeah.
significantly, even just in the last 5 years. Can you tell me why there's been a shift so significantly in the last 5 years?
I think that developmental care previously was considered a soft science, like, you turn off the lights, you put a nest in, but it's something nurses do, but it may or may not have a difference. Whereas I think the evidence has sort of really become indisputable that these babies' brains are affected by being in a NICU, that being in a NICU or a pediatric intensive care unit, to be honest, for any neonate in hospital, there is a potential risk for you in terms of your longer term development. And there's this real sense, I think, in the past 5 years or so that all of these great things we're doing in the NICU are not enough and we're
Mm,
having to refocus. And part of that refocus is that one of the most recurrent things that babies experience in a NICU, particularly in high income countries, particularly in countries such as America, United Kingdom, and Australia, are that nurse delivered caregiving is actually the things these babies are exposed to the most. So I think there's been this shift from technology to the shift towards actually it's the relationships as well. So how can we foster relationships and how can we help parents to parent? Because parents are the ultimate buffers and we can't really not i- not include parents in what we're doing anymore. And unit design has changed. Like, it's really not acceptable now to build a NICU that is not centered around a parent. And there's couplet care in, I think it's Vancouver opened a couplet care unit. There's couplet care units in India. There's couplet care units in Sweden. So really this orientating the NICU towards the parent and the baby and away from the technology, I think has been the biggest shift.
Yeah, and this, when you talk about, some of the improvements that we're seeing, there seems to be a little, I feel like we've had some leaps,
Yes.
recently, and I think that that's definitely showing up. We're hearing it, definitely at this conference this year, which, there's several people that are, talking about these different aspects, which is really exciting because it means that people that are still struggling, can really start to, develop more skills. I thought what was really interesting about your presentation was a lot of the time when it comes to NICU, there's cost involved, there's policy practice, there's big changes that have to happen. Your presentation really didn't require any of that. That's what I thought about your presentation when I heard it, was that you really gave me the tools. I could go, into work today and I could just change it, so and so very, very practical. Is this something that tell me a little bit about your work environment? Because I'm just wondering, is it like this all the time? Because it sounds sublime. I mean, it sounds like the perfect NICU. I want to, if
It's
I ever
not.
had a NICU baby again, I'd be bringing it to you type of thing,
I actually am one of those nurses who works in a challenging NICU environment. We are building a beautiful new unit, and we are building a new unit that we're moving into in 2026 where parents will be able to sleep at the bedside in our NICU, and that is our goal. And it's taken a lot of sort of discussion to get the team on board, but we're there. But I work in a unit that's intimate and rustic is the best way to describe it. We are
Okay.
30 years old, and
Right.
if you swung your arm around, you would hit another bit of equipment, another family, etc.
Mm,
However, a big part of the caregiving is the culture of the caregiving. And so you work with what you have. We can't
hmm
knock walls down. We can't build new units just because something's changed, etc. So we have an incredible culture of caregiving in our unit, and we do what we can with what we have in our environment. That doesn't mean our environment's not noisy. It doesn't mean it's not that there's not lighting challenges. But what it does mean is we work to buffer against those, and that we really work hard to make sure we do the best we can. And I think I'm very privileged. I get to present to developing countries quite regularly. And I really say to them, all you need to do developmental care is a set of eyes, a pair of hands, and some linen. And if that's all you've got, you are already ahead of the game because
mm,
you don't need high tech things. You just need, and the fourth thing you need is a parent. And if you've got
mm,
those four things, you're winning. So you do the best with what you have. And Hadley Zales, who was the founder of NIDCAP, really said, the four walls don't matter. It's what you do in the four walls that make the difference. And that's sort of my philosophy. It's what we do in there. It's never going to be perfect. Humanity is not perfect. Life isn't perfect. And it's not sterile either. We don't want it to be a sterile, vacant environment. We want it to be a place of sound, interaction, and connection. And sometimes that means it's messy, and that's okay.
I really appreciate that. That's a great quote as well. Tell me, switching gears just a little bit, because I wanted to get this question in right now, but I feel like a lot of people have moved on from COVID.
Yeah.
Um,
God, you'd hope
it,
so.
right? We're
Yeah.
back into doing life again. Tell me what the impact has been for our NICUs in terms of COVID. What happened?
It was devastating, to be honest. The Vermont Oxford Network in Canada called it an extinction event for family centered care, and that it put family centered care back by 10 to 15 years. And it has. It's given administrators excuses to create barriers for families to be in neonatal units. And part of that's pervasive and it continues. And so we are lucky in the unit I work in. We were very, the nursing group in particular, were very strong and came together, and we really advocated for parents throughout COVID. That doesn't mean there weren't restrictions, and it doesn't mean it was really ethically challenging to work in an
Hmm.
environment where you support family centered care, but you can't enact it. And
Right.
so, I think that there were countries where mothers were allowed in for 15 minutes a day, and babies were being taken off their breasts while they were breastfeeding because the
Mm,
15 minutes were up. So it was traumatic, and I think there's a lived trauma for the healthcare professionals who did it as well. But what we need to be careful is parents weren't necessarily the people who were bringing in COVID into the units or respiratory illnesses. There is great research from Japan actually that showed that prior to the COVID, so in 2018, they did research and it was about, do siblings bring in infection to a neonatal unit? And they found that siblings were not responsible for the viral infections in the neonatal unit. It was the healthcare professionals. And so I think
Right.
that we've got to weigh up the benefits, and
Hmm.
we have to have learned from COVID. And the learning from COVID is not that keeping parents out of a NICU saves their children, because babies were unaffected by COVID. And that was the great irony, is
Right.
children were relatively unaffected by COVID. And
Yes.
whilst our workforce was affected by COVID, and we didn't want to get into a position where obviously we couldn't have clinicians to care for sick babies. But yeah, I hope there's learning from it because it was horrific.
Yeah. I'm so grateful to you, your staff, from coming together. And I am hearing that there is a tide of change. I just wanted to highlight it again here today so that people really have that awareness so they don't feel alone. So if you're sitting
Yeah.
right now listening to this, you're not alone, but there are things that you can do, to continue to build out, what is needed and look at the research, I think is what Nadine is sharing with us today. So thank you so much. Truly appreciate you being here today. It's so lovely, to have you. And this presentation, as I said, is absolutely fantastic. So make sure you check it out. You can head over to goldneonatal.com right now and check out all the details, including from Nadine and her presentation. Thanks for being here today, Nadine. It's been lovely having you.
Thank you for the opportunity. I appreciate it.
And thank you again to all of our viewers. We'll look forward to seeing you online. We can't wait to share this conference with you. Bye-bye for now, everyone.